Hey Amanda, my goodness, how have you been?
Good. I kind of like working from home.
Not that bad, huh? Not that bad of a gig?
No, definitely not. It's a little harder to start and end your day. I definitely found myself working probably more, but overall, it's been pretty good.
So, hey, I just know so many things have changed these days, and I would love to just get your take and just hear from you how the role of content has changed as the pandemic has gone, and especially as we've started going from full on crisis and rapid response mode to some version of recovery. How has the role of content changed for you and your team?
It's interesting. I don't think that the role of content has changed that much. It's really just been, more important than ever. We use content to inform, educate, and empathize with people all the time. And, our strategy has always been around being useful, helpful, and relevant to people. And that hasn't changed at all. It's just been more, the subject matter has changed, right? I mean, COVID has been front and center for months now. For a while, it was exclusively all that we were talking about or doing. Now we're starting to mix in some other things in there, but it's still very much about being helpful to people, providing the information people need to make decisions and get care and do the things that we want them to do. But I think the role of content is critical all the time in building trust and building relationships with patients. And like I said, now it's just even more important than ever.
Yeah, you mentioned some at one point it was very heavy COVID content, which I think was the case with the majority of healthcare organizations out there. But then there was a point where you said, okay, not so much. You started mixing in other things. Tell us how did you know when that point was?
Yeah. So, as we always are, our team's pretty data driven and plugged into like what's happening on all of our platforms, what content's getting engagement or not, or, what's working, what isn't. And for, a good chunk of time, we were all COVID all the time. And it was just constant iteration of like, okay, what's today? What are we adding to that mix? But then you started to see a few weeks ago, kind of the COVID fatigue. People were like, okay, we're settled in. We know what it is. We know what it's about. And now we kind of got to live with this. And we're in this situation, stuck at home most of the time. And so we started to mix in other things, but still having to be really relevant under the circumstances, and really thoughtful about the imagery associated with content and, being mindful of the fact that, people aren't doing things quite the same way anymore. And so, it's a balance. We still want to make sure we're including COVID content every day because the pandemic is still going. People still need to be careful and cautious, and we're cognizant of the role we play in sending that message. So, it's just, we sprinkled some things in, and we sprinkled in a little bit more. And I would say now it's about half and half for us, but still very cognizant of what's going on around us and making sure that, we're providing answers and information people need in the moment.
Yeah, tell me more about the visual aspect you just mentioned. How do how important is that? How has that changed in terms of like what you need to be showing people these days?
Yeah, it's actually really difficult because pretty much most of the photography that we have from pre-pandemic is irrelevant when it's showing people in our facilities because most of the time they weren't wearing masks. And now we need to show caregivers, we need to show patients wearing masks, we need to actually really make sure that we're accurately visually reflecting what that experience is going to be for people. I think one of the most important things that we're doing with our content, with our website and social is alleviating those fears and trying to get people to come back to our facilities. And in order to do that, they have to understand what it's going to be like. And so, we're really trying to make sure that everything we're putting out is accurately reflecting what the experience is now and what care is going to be like going forward.
What you just described was showing and not just telling.
Yeah, that it's so important, and I think you can't just flip a switch and say we're open again. It's not enough. And, it was really easy to tell people not to come in, stay home, stay safe, right? That's a simple, clean, easy message. But now, we have to convince them to come back and we have to make sure they understand what we're doing to make it safe for them, right? And that's not just words, showing them what it's going to be like to use a valet service that's now going to be like masked up and gloved up and wiping down all of your stuff. That can be intimidating, and it's the first thing they see when they pull up. There's also this huge risk of people not coming in when they really, really need to be. It was scary when everyone was seeing ED volumes dropping because they weren't coming in for care. Well, why is that? What are we doing to make sure they understand why it is safe and why it's okay to be there, not just to say our EDs are still open? Well, that's great. but what's it going to be like when you get there? And do I need to bring a mask with me? And like all those things that just create so much anxiety for people. The more we can alleviate that, show them what it's going to be like, manage those expectations so they're fully prepared and really ready.
So if you had one message to kind of boil all that down for our fellow healthcare marketing and communications professionals, so others in the industry who are dealing with the same things and maybe just don't have they just haven't approached it the same way, what would be one message that you would share with our fellow healthcare marketing and communications professionals?
It's the same message I've been sharing forever. And it is really listen to your audiences and, listen to your patients, listen to your website visitors, your social media followers. Where are they in this journey? What are they feeling? What are they asking about? Be empathetic to that and put content out there that solves those problems, answers those questions. It's not enough to just say, we're here and we're great and we can care for you. It's really all about them. Listening and paying attention to your audience and how they're feeling and what they need. Give that to them. If you can give that to them, you build so much trust, and then they don't hesitate to come see you. They have that relationship with your organization, and it makes you 10 times better.
Well, I think one other aspect of the entire situation this year has been the emergence of relationships that we've established with professional relationships within the industry, within our community, because it really is a community. And I haven't seen a period where that has been made more manifest and more important, at least to me, than now during the pandemic. And I'm curious what it's been like for you in terms of how have you leaned on the community, and how important has it been to have those relationships that you've created and established. Some have been in person at conferences, and some have been virtual. But what's it been like for you to lean on the community?
Sure. I think once we were able to come up for air after the first few weeks, these relationships become really important because we're all figuring this out together. Nobody's lived through this before. And so, it's real-time learning together, and to be able to see something from an organization that you respect and admire and know the person to reach out to and ask how they did it, or to understand what it would take to do something like that, or how it fits into your own space or universe. And then, also the opportunities to connect like this and to talk to other people about what we've learned along the way. I think it's just phenomenal. And it really does make a huge difference to be able to talk to people who are going through this in the same ways that we are. That relatability is really important. There's not a lot of people outside of our little circle who really do understand how intense this has been, how difficult it is to communicate under these circumstances, and to just be there for each other is a really phenomenal and important thing.
I can't say that enough. I feel the same way. And knowing that empathy isn't just part of what we're communicating to patients or consumers or providers, but it's to each other. It's to our colleagues. It's just reaching out to somebody and saying, hey, just checking up on them, but also saying, hey, how did you guys deal with this? And I appreciate you even taking a few minutes today to share some of that, helping us all understand what you and your team have gone through, and seeing some of the triumphs and successes you've had, and recognizing that these challenges aren't going away, but that you and your team are dealing with it in the way you can, and others will do it in the way they can. It makes so much difference just to hear that from other people.
Absolutely. And it's so nice to just get that random text or, email that's just like, hey, how are you? How are you doing? Because everybody's going through so much right now and just dealing with a lot of crazy changing landscapes of work that, it's just really nice to feel supported.
100%. Well, Amanda, thanks for giving me a few minutes today. Stay safe, stay well, and I look forward to keeping in touch.
Thanks, Jared, so much.